So, good afternoon, everyone. We are thrilled to welcome you to the next exciting and inspirational episode of Concorde Conversations. This is a new initiative by Concorde Medical Group to educate, empower, and encourage our community to improve their health. Today's discussion is Walking on Sunshine. It's a discussion about running and walking. I'm Dr. Catherine Weinberg, Director of the Adult Congenital Heart Disease Program, and I'm joined by two fabulous and brilliant colleagues, internist and marathon runner Dr. Daniel Silvershein and sports podiatrist Lori Weisenfeld. Before we begin, let's set some ground rules. First, we will be recording the session. So if you do not want to appear on the recording, please stop your camera. Second, please remain muted during our discussion to avoid distracting others. Lastly, many of you have sent in excellent questions, which we will be discussing today. If you have any additional questions, please ask them in the chat box. We only have 30 minutes together, so we're trying to go through as many as we can. Remember, this is general guidance. If you have a particular question about your health, we want to help you. So come in for an appointment so we can answer your questions and give your health the attention it deserves. So let's get started.
Exercise is great for your health on many different levels. First of all, from a cardiovascular standpoint, as you, Kathy, know, it will always improve your health. From a nutritional standpoint, in terms of calorie usage, helping maintain your weight, also very important. And finally, from a mental standpoint, I think it's actually quite important. I run a lot, and I find that it's a really great way to let some of your thoughts go and release some of the energy, the stress energy that you accumulate through life. And so as we go through and as we train, I think that we have a better sense of well-being, both physically and mentally. So the textbook answer of that is 150 minutes per week. However, we take what we get. So when you're starting, there's no expectation that you're going to have 150 minutes. And when you're in better shape, you'd likely to do more. But in terms of setting initial goals, 150 minutes a week is pretty much the ideal. That can be broken up in any segments that you wish to break them.
In my practice, by far the most common running and walking injury would be heel and arch pain. Other things that people complain about frequently would be calf pain, Achilles pain, bruised toenails, knee pain, a variety of muscle injuries. But by far, the most common would be the heel pain.
Had them all, love them, don't want to get them again. So listen closely to Dr. Weisenfeld. She knows what she's talking about.
Heel pain is usually caused by something called plantar fasciitis. The plantar fascia is a ligament type of structure that runs from the heel to the ball of the foot. And when you're overusing it and you have lack of support under that ligament, it can pull and stretch and aggravate the heel. The most common symptoms of the heel pain, plantar fasciitis syndrome, would be pain after periods of rest. You first get up in the morning and you feel like you're clomping around, you can't put your foot down, and then it eases somewhat as you take a few more steps. The most important thing to remember for the heel pain is to think about support. Examine your shoes. Make sure they are more supportive than what you would normally walk around in. Make sure that you're not walking around barefoot while you're at home. Use something with good arch support. And support and cushioning are two different things. Another important thing to do is ice after exercise. Ice should be placed on an inflamed area for 10 to 20 minutes at a time, not more than 20 minutes. And calf stretching is very important because when your calves are tight, it sets up a chain of events that causes your arch to collapse more while you're walking and running. So those are three things that you can do by yourself. In addition, you could try an over-the-counter arch support. If those things don't work, then it's time to see your healthcare provider. So in general, foot pain or any pain, in fact, is not normal. You should not have consistent pain without paying attention to it. That's your body's way of telling you, hey, something's going on here, listen to me. So I always tell my athletes, walkers, runners, weekend warriors, that when you go out and you start an exercise program where you're ramping up a little bit, it's normal to have aches and pains. It's normal for your thigh muscle to be sore one day and your calf muscle to be sore another day. But if you have the same pain consistently each and every time that you go out for exercise, then that's something to pay attention to, or if the symptoms are escalating.
There's been a lot of research about shin splints, which is usually the main cause of shin pain. And certainly the initial thought is always going too fast, going too quick, going too long. So ramping up your mileage too quickly is usually the number one reason why people develop shin splints. But some of the research actually also says that your stride length makes a difference as well. So the first thing I tell people when they have shin pain is to shorten your stride length, and to think about having your foot land closer to, your shoulder, the axis sort of between your shoulders and your hips. Get your feet underneath you, and you'll tend to have less shin pain.
There are two types of shin pain. One would be on the front outer, and one would be on the back inner. Anterior shin pain and posterior shin pain. So if you have shin pain on the inner side, closer to your big toe, many times that's also because those muscles on that side of your leg are responsible for holding your arch up. So if you're wearing shoes that are not giving you enough arch support, that could be the cause, in conjunction with too much too fast too soon. For the outer shin pain, a lot of times it can be shock absorption that's the problem. Doing too much hill work. And believe it or not, the anterior shin pain is much more common in people who are speed walking than running. Because in speed walking, you do have a longer stride. Those muscles in the front of your leg have to fight a tight Achilles often. So many times putting heel lifts in and stretching your calves is helpful. But again, slowing down and shortening your stride for the anterior shin splints is important.
I think one of the recurring things you're going to hear today is that we think of running and walking as an endurance exercise, but strength is a very important part of this. And strength is what keeps everything in line. So you have to focus a little bit more on the strength than just thinking about how long and how far. Okay, so that's further up the leg, so I guess I'll take that one. We like to think of problems as actually also going from the ground up, though. So when you're thinking about knee pain, a lot of that has to do with the way your foot is striking the ground. And when you're striking, is your knee in a flex position or an extended position, right? So when it's flexed, it can act as a spring, right? So it'll push an impact and then rebound. When it's straight, then all that force goes straight right through the joint and then right up through your hip and almost all the way to your skull, effectively. So what we want you to do is to be a little bit more out on the front of your foot when you're running, and when you're walking to sort of roll over. With regards directly to the pain, though, if you have a little bit of discomfort the day after, a little soreness, that's fine. But the attitude, the sort of precept I live by is bad things don't get better. So if the pain persists, that's when you really should start to think about seeing your provider. But a little pain's okay, a little soreness is okay.
I assume that we're talking about not severe knee pain or swelling. Obviously, if you have a traumatic event, you fall down, or if your knee is very swollen or hot, that's nothing that you should be running through. That's something that you want to seek immediate attention for. But again, just to reiterate what Dan said, everything comes from the bottom up. You're striking with your foot. The kneecap is flat on the surface here, but it's triangular on the bottom, and it fits into a triangular groove in our leg bone. And if everything is going nice and smooth, we don't have pain. But if for whatever reason it's doing this, then we're going to get pain underneath the kneecap. Several points on that is that it's important to keep the thigh muscles, your quadriceps, well balanced and strong. So that's one component to rehabilitating the knee. And it's also important to think about the position of your feet. So if this is continuing, that's where I would come into the picture. I would look at the position of your feet and see how you're landing and make sure that you're progressing through your stride properly.
Okay, it's a difficult question in some ways. Running with Achilles tendonitis is difficult in and of itself because it's uncomfortable, and it's uncomfortable when you run. And the concern always is that when you're uncomfortable and you run, your stride changes, and when your stride changes, you become more prone to injury. What I usually suggest to patients is that they take some time off and focus a lot more on stretching, right? The Achilles it's like a rubber band. It's tight, and when it's too tight, that's when it starts to get inflamed. So taking some time out, dedicated stretching, strengthening of your calves, right? Using, lifting up your heels, and stretching out the Achilles, and then dynamically warming up when you start your walks or runs. So getting some blood into your calf muscle, getting some blood into the Achilles is really how you're going to keep the tendon limber as you go through. So you can't really stretch before you run because it's too tight, you'll just tear. What you really want to do is take some time, go slower, ease into your exercise. And in the first couple of minutes, you want to actually exaggerate your motions slowly, because that actually gets a little bit more stretch into the tendons themselves.
The current paradigm for stretching is to stretch after you're running or walking or exercise versus before. As Dan said, you want to warm up before and stretch afterwards. But my personal feeling is that stretching doesn't happen in a few seconds after you exercise. You're not going to gain length to a muscle if you're stretching for 1 minute. I think stretching is a habit that people should get into doing every day, regardless of warm up and cool down. As we age, we don't get more limber, we get tighter. So it's important to add that to our daily routine. Stretching should be gentle and held for a prolonged period of time. We don't want to bounce. We don't want to just do a couple of putting my legs up on the table and stretching. It's a habit that we need to get into. When your muscles in your lower extremity, forget about your back, that's a whole different conversation that we don't even have time for. But when the muscles in your calves and your thighs are tight, it puts a big strain on your back, your knees. Just standing up is a strain on your lower body. So it's important for us to get into the habit of stretching on a regular basis.
There's a difference. You can get the length into the muscle one of two ways. You can actually actively try to stretch it out by stretching out the tendon itself, which is your traditional stretching strategy. And then you can use a roller, and a roller puts pressure directly down on the muscle itself. And what that does is it breaks some adhesions in the muscle. So as you exercise, right, you get small tears in the muscle, and you get a little scar tissue here and there. It's not apparent, but it's sort of in there. By using a roller and applying pressure down, you break up that scar tissue and thereby let the muscle stretch out more that way. And so you have to use both in order to really get length into the muscle itself.
Some people use on the feet a little ball. So you could use a ball or a spiky ball, or a lacrosse ball is popular for some reason. And you could do that on the foot, or in fact, in areas of your back that are hard to reach. But they do sell foam rollers that are relatively inexpensive. They sell stick rollers, they sell vibrating rollers, all kinds are available commercially.
Everybody has a preference. I use a stick roller because I like the firmness of it. And I like the fact that you can use it all over all your bodies. But it's almost like flossing your teeth in that respect. You have to, like flossing your teeth is a part of brushing. Rolling your legs is part of stretching.
So that's very confusing and frustrating, because the shoe companies are constantly changing how they make and design the model. Even if you're buying the same model year after year, they can be different. They discontinue models. So it's frustrating for everybody. If you're frustrated about this, you are not alone. I like running shoes for walking. I think it's very important to wear either a running or a walking shoe when you're doing those activities. But I tell most of my patients it's okay to use their running shoes when they're walking. There are three basic categories that the Manufacturers split their shoes into that will be cushion, stability, and motion control. And the shoes in between are a spectrum. If you have a very high arch foot, generally we tell you to stay in the neutral or the cushioned shoe. If you have an extremely flat foot, then we put you in a motion control shoe that has more support and a lot less cushioning. If you're somewhere in between, if you have normal arch that may roll in a little bit too much, or a very flexible foot type, then we put you in that middle category, the stability shoe. And you have to understand that, again, if you fit into a particular category, but you have a different injury, you may need to switch to a different category. So it is a little bit difficult. What the current train of thought is, believe it or not, is to try the shoe on and see what feels most comfortable to you. And then there's a whole question: how high should the heel be? How low the heel should be? That can also be confusing. But if you do need good advice, there are some good websites out there that can give you advice. Your podiatrist or your sports professional can give you advice. And the better running shoe stores, they can give you advice. They can put you on a treadmill and see how you're running to see how you do.
Now, with regards to running, though, shoes actually, even the same shoes actually take on a little bit of a different role, because in a running stride, in a walking stride, normally you strike off your heel and roll off to your toe. In a running stride, we want you to strike further up in your foot, more off the ball of your foot or just behind the ball of your foot. So motion control no longer becomes an issue because your arches stop playing as much of a role in the running stride as a walking stride. So to try to simplify things for runners, I actually just try to break it down that you have basically two different types of shoes. You have cushion shoes and you have responsive shoes. So when you land, it's either going to feel kind of cushiony or it's going to feel a little stiffer. And then within that, you want to see what you feel more comfortable with. Personally, I like responsive shoes because I like to feel that my foot's stable when it lands. And cushioning sounds great because you're cushioned and it might prevent injury, but I always felt that for me personally, a responsive shoe is nice because I feel solid when I land on the ground, and when I push off, I feel the shoe almost snap out and actually help propel me. So again, running, walking, you have to use your shoes that have to be tailored directly towards your foot and what you're doing.
So the stated rule is between 200 and 400 miles, but every person is different. It depends on how heavy you are, obviously. It depends on how much you perspired. It depends on what type of surfaces you're using them on. So 200 to 400 miles is a guideline. Obviously, if you are a 115-pound woman, you're not going to blow through your shoes as quickly as a 185-pound man who has a heavy stride and is, just pounding away on concrete all the time. So the rule is about 200 to 400 miles.
Yeah, it's become a little bit more of a thorny issue now. It used to be that the rule of thumb was if you looked at the bottom of your shoe and you wore through any part of the sole, that your shoe effectively needed to be changed. But before that, it was fine. Now, shoe companies, have these very technologically advanced foams that they put in their shoes. And it's great because, as I was talking about before, you get a nice balance between cushioning and responsiveness, but the lifespan of the shoe goes down. And so elite runners, the shoes that you see the marathoners wear in the elite marathons, those shoes may only last 100 miles. So you have to just be careful. And usually when you go to the store, your salesman should know, a good salesman should know how long the shoe will last for in terms of mileage.
One other thing I like to follow up on that, people do come in and they say, oh, look at the sole of my shoes. This looks pristine. But if you're running and you're dedicating those shoes to running or walking on the treadmill indoors, those shoes will always look pristine. But the midsole, which is the part that gives you the support and the cushioning, that blows out a lot more quickly. So looking at the sole of the shoe is an obvious way. If you're worn through the sole, then clearly you need a new pair of sneakers. On the other hand, if you're not worn through, that doesn't mean you haven't passed the peak of the shoes. So over-the-counter insoles or arch supports are the ones that you could just walk into a store and purchase. I liken the difference between those and a custom orthotic to the difference between going into the drugstore and buying your reading glasses versus going to an eye specialist and getting a prescription pair of eyeglasses. If you have any particular need, if your arch isn't the average, or if you have an injury, it's likely that you'll need a custom-made arch support, which is called an orthotic or foot orthotic. When you go into a podiatrist to be evaluated for a custom foot orthotic, he or she will measure angles that your foot has, the forefoot to the rear foot, the position of your knee, what the range of motion of the different joints are, evaluate which areas need more padding, which areas need cutouts, add a heel lift if one of your legs is shorter. So there's a lot that goes into it. He or she will make a mold of your foot, which then goes to somebody called an orthotist, who will fabricate that orthotic with the exact materials and prescription that your podiatrist has asked for. Versus an over-the-counter is made for the average person, and they're good as a starter if you just want a little extra cushion or arch support. So it's good if you want to try those first, but if those aren't a success, the next step would be to see a podiatrist to ask if you would benefit from a custom-made insert. Okay, so blisters are caused by friction. Anytime you have rubbing, you can get blisters. So people who tell me, I got this blister, I don't know what it's from, that doesn't really make sense. It's always from something rubbing, whether it's your toes rubbing against each other, your sock bunched up or rubbing, or your shoe rubbing. It's from friction. So the first thing to do if you have a blister is to try to figure out exactly what's causing the rub. If you do get a blister, it's okay if it's tense, it has a bubble-like top, that means it has fluid in it. It's okay to drain the fluid out of it by lancing it where the top meets the bottom. So the top portion is just the top of the bubble and it has no sensation. You could just lance that very easily and let the fluid out, and then leave the cover of the blister, the top part of the blister, on to act as a biologic dressing. You want to keep it clean and covered with a Band-Aid until it heals. As far as preventive, obviously, if you can get rid of the cause, you can get rid of the problem. Some runners get a lot of blisters between and underneath their toes, and they find that using Vaseline on their toes before they walk and run is helpful. Also, if you notice any red areas of irritation that you feel might become a blister, you could use some moleskin, which is a very thin, adhesive, felt-like substance, right directly on your skin. But the main thing is to get rid of the clumps.
Walking and running are actually quite different motions. When you're walking, one of your feet is on the ground the entire time. And when you run, you're propelling yourself, you're actually leaving the ground. So the first thing that you have to remember, again, we talked about, is that you need more strength to run than you do to walk. And you need more muscles to incorporate in order to run. So the expectation is, as you're moving from walking to running, that you're not going to have strength in certain parts of your legs, your quads, your hamstrings, to propel yourself for long periods of time. So what we want you to do is build in small segments of running in between your walking longer segments. So 30 seconds where you're running, and you're focusing on landing your foot, again, landing just behind the ball of your foot, and keeping your hips and your spine in line, and then resting by walking. Because if you push too hard too quickly, and we've talked about this already a couple of times, if you push too hard too quickly, you will get injured. By incorporating small segments, adding segments on, lengthening them out just a little bit, you can transition fairly quickly and safely from walking to running. Okay, so I guess I'll go first. Be patient and set reasonable goals, right? Endurance training, which is running and walking, building is very slow. And so sometimes you won't see the results for a while. And you want to push harder. You have this tendency, right, to try to get to a place. It's like you need to rush to get to a place quicker. Take your time with it. If you take your time with it, you will build, you'll be strong, and you will not get injured.
From a podiatric standpoint, two things. Number one, foot pain is never normal. If you encounter any swelling associated with the pain, it's something that you need to pay very close attention to. And the other thing is that I truly believe that it's very important to invest in a good pair of athletic shoes, specifically for running and or walking. That's the only piece of equipment that you're going to be investing in initially. So it's important to do a good job with it.
Thank you all for joining us for another inspirational and educational episode of Concorde Conversations. We know many of you have additional questions and we'd like to help you, so come in for an appointment. We care about your health and we want to help you. Have a wonderful day. Thank you for joining us. Bye.
Thank you all.
Bye.
Bye-bye.